To the stage, fellow founder of CRIS Cancer Foundation, would you please give a round of applause for Diego Megía? Here he is.
Good evening. Good evening and thank you. Thank you very much for being here tonight. One more year, one more gala. So I'm going to be very brief. This is good news. But I need to tell you something, just a couple of things. You have seen in the video what we have been doing here in UK, the new collaborations with Oxford University, the new collaboration with GOSH, the reinforcement of the collaboration with the Institute of Cancer Research, our long-standing partner and a beacon of excellence. But this is CRIS UK. We all share this mission of eventually trying to have excellence in research and collaboration. So there are a few things I want to mention, things that have happened this year, in 2022, that basically make us very happy and give us lots of pride. We have started a collaboration this year with some other charities. It's a pan-European one. It's called Fight Kids Cancer, with 8 other, I think, charities that basically together will allow us to do, I think, 6 clinical trials for, as I say, for pediatric cancer. As you know, a cause very close to our heart. And we are very happy to basically be ticking those boxes of collaboration and excellence in the projects. Thank you. We have also started a new collaboration this year, a new project in France with the Institut Gustave Roussy. Again, they're co-funding part of the clinical trials. CRIS is funding the other half. And we are forcing collaboration between France and Spain of doctors and researchers that they have to basically pull together and come with these clinical trials. So we have done quite a few things along these lines of trying to make the world of science smaller. Obviously, we have also continued our collaborations in the US with the charities that we work with, Prostate Cancer Foundation, Damon Runyon. Basically, we help them to fund the research fellows when they want to come to Europe to develop a career. We are basically funding those fellows. But again, this is 2022, the year is almost over, so we are finishing, and it's much better always to talk about the future and what is coming, and the pipeline, and what lies ahead. So for that, given that we are discussing something that basically touches us all very closely, but we have real experts in the room. We have actually the actors of this change. Basically, we have the scientists with us. And I am really, really curious to understand what shall we expect, what lies ahead for the future. So without further ado, I'm going to ask them to basically just in a few seconds to explain us all what are they working on and what shall we expect. And I need to take the list. So Professor Kristian Helin, if you can start.
So my name is Professor Kristian Helin. I'm working at the Institute of Cancer Research, where I'm also the Chief Executive Officer. So first of all, I'd like to congratulate and say many thanks to Lola and Diego and the CRIS Foundation for all the support we are getting. Thank you very much. So at the Institute of Cancer Research, we are developing new drugs based on the knowledge and the research we are doing at the Institute of Cancer Research. What we are doing is we're also developing that in the future. We have basically invested in exciting new technologies, in new research centers, and we hope, or I hope, that this will develop new drugs for the future and an accelerated rate compared to what we've seen before, And it's, of course, very important that we are supporting that. So with that, thank you very much.
Thank you. Professor Mark Middleton.
Thank you very much. I'd like to reiterate the thanks that have just been given to Chris and to Diego and Lola for the support that we're enjoying in Oxford. My name's Mark Middleton. I'm a medical oncologist, and my research is in giving new drugs to patients for the first time when they come out of the lab. Today we've got fantastic tools to study what those drugs do in our patients and our tumours. In fact, we've got more data than we know what to do with. And what we're working on in Oxford is developing the new analytic tools and the new cadre of young scientists to do that analysis so that we can make sense of that data and bring it back to the patients to accelerate research and get better drugs for the next generation. Thank you.
Thank you. Professor Kevin Harrington.
To this camera, apparently.
Thank you.
So, hello everybody, and thank you very much indeed, Diego, for this opportunity. Thank you to Lola and to Chris for this opportunity to speak to the room. What another fantastic evening, and thank you so much, Chris, for the support to the ICR. I'm Kevin Harrington. I'm the head of the Division of Radiotherapy and Imaging in the Institute of Cancer Research. And my vision for the future is that we are going to exploit the very best technologies for delivering radiation therapy to cure patients, but we're going to ally that with some of the new drugs that we're developing within the ICR and also elsewhere in the world, so that we will cure more patients with fewer side effects, and we will deliver more cures long term so that patients can live their lives free from the fear of cancer. Thank you.
Thank you. This is Professor Alan Melcher.
Again, just to say thank you so much for having us all here. So my name is Alan Melcher, and I run the Centre for Translational Immunotherapy at the Institute of Cancer Research, which Lola mentioned and which Chris has been instrumental in supporting. And for me, the future is really important in terms of learning as much as we can in terms of what happens in patients to their immune system as they go through treatment. So we really need to understand the biology and the immunology science that goes on in people so that we can really understand why things work, but equally important, why they don't work when that unfortunately happens. And I think that kind of knowledge and insight is going to be essential for us to develop the next generation, particularly of immunotherapies, for the benefit of all. Thank you very much.
Thank you. Professor Joaquín Martínez, that's the name I can say the best.
Good night, everyone. My name is Joaquín Martínez, and I am hematologist, and I am the head of hematology of Hospital Octubre the 12th. I'm also director of the scientific director of the CRIS Foundation. First, we think that we can cure some cancers now, but in the future, I think we have to cure more of the cancer, and I think CRIS is going to help to do it, and we need your support. The ambition of CRIS Cancer is to cure of or chronicle the cancers in 2014. And the second thing, we have to work in the prevention. Prevention is very important. And for example, we now know that, for example, for myeloma, multiple myeloma, the precursor of multiple myeloma is called NGAS, and this is very frequent in the population. And this is a scope. We are working now in some natural products of the nuts that can prevent multiple myeloma. I think this is the future. Thank you so much. We need your support a lot for that.
Tasa.
Hello, my name is Dr. Astero Klampatsa. I work at the Institute of Cancer Research in London. And I specialize in a cancer called mesothelioma, or else asbestos cancer. I try to understand this cancer and I try to cure it by a new form of immunotherapy called CAR-T cell therapy. For me, the future is the investment into the scientific talent who are dedicated in discovering, transforming novel immunotherapies such as the one that I am, and actually making a huge difference and curing patients. Thank you very much.
Thank you. So, Dr. Charlotte Paulin.
Hi, thank you for inviting me to speak, and I consider myself very lucky to be fortunate to have received one of the boosts that Lola talked about earlier a few years ago to help me set up my own independent research career. My name's Dr. Charlotte Paulin. I specialise in the bone marrow cancer, multiple myeloma at the Institute of Cancer Research and the Royal Marsden Hospital. I work in the clinic seeing patients, setting up clinical trials, and also in the lab trying to understand how we could improve outcomes for patients with this disease. For me, the future is about strengthening those links between the clinic and the lab so that we can learn as much as possible and take things back and forth to improve our understanding, to try and stay one step ahead of the disease and keep patients in remission and well for longer. Thank you.
Thank you, Charlotte. Thank you. I think Dr. Dimitrios Dolcinos.
Thank you so much. It is truly a humbling experience to be here, truly privileged to be one of the new CRIS Cancer Foundation Research Fellows at Oxford University. I work on prostate cancer, and I think that truly the aim of the future is to invest in people, very talented people from different backgrounds, and the newest cutting-edge technologies that will help us tailor therapies to each and every person, because we see treatment resistance on the rise. So making sure that we have tailored therapies, personalized medicine for every single patient out there is particularly important. Thank you very much again.
Thank you. Dr. Matthew Clark. Thank you.
Good evening, everybody. My name is Dr. Matthew Clark, and I'm a neuropathologist based at the Institute of Cancer Research and the National Hospital for Neurology and Neurosurgery in London. And I'm part of a team that focuses on research into brain tumours and those that occur in the spinal cord as well, looking to characterise and classify them and look for new targets for treatments for the future. I think that the future depends on continuing to support collaboration both nationally and internationally, both in terms of funding and expertise, to unite us all in the focus on our questions that we have that cancer presents us with. But also I think we need to bridge the gap between research and the clinical translation of that research, and finally also support, develop and inspire the future generation of researchers who are going to continue these questions, answering these questions in the future. And thank you very much to CRIS for all they do to continue to support us in this work. Thank you.
Matthew. And lastly, Dr. Nanclares.
Hi everyone, thank you very much for tonight, thank you very much for your support. My name is Pablo, I'm a clinical oncologist. I work at the Royal Marsden Hospital and at the ICR. I specialize in head and neck cancer, and my research, which wouldn't be happening without CRIS support, is focused on the immune changes secondary to radiotherapy. I feel that the future depends on personalized, high-precision radiation therapy, which aims to stratify and to treat each individual cancer patient differently by using biomarkers of response as well as advanced technology in radiotherapy and combination treatments with immunotherapy and targeted therapies. Thank you.
Thank you. Thank you, everyone. Thank you to the doctors, and please enjoy the dinner.